What I am about to tell you today could genuinely save your life or the life of someone you love. There is a virus spreading quietly across parts of the United States and other regions of the world right now that many older adults have never even heard of. Most people are not being warned properly about it. Most seniors do not know what it looks like, how it spreads, or how quickly it can turn deadly. And the frightening part is that many people are exposed during completely normal everyday activities. Cleaning a garage, opening a cabin after winter, moving old boxes in a basement, sweeping out a shed, things millions of older adults do every single year without thinking twice. But for some people over 60, one exposure has been enough to send them into intensive care within days. The virus is called Hantavirus. And today I am going to explain exactly what it is, how it attacks the body, why older adults are at much higher risk, and the specific things every senior should start doing immediately to protect themselves. Please stay with me until the end because the number one mistake many older adults make around this virus is something most people think is completely harmless. And before we continue, welcome to Senior Health with Dr. Sarah Mitchell, where we talk about the health risks, warning signs, and practical habits every older adult should understand to stay safer and healthier after 60. If you find this kind of information helpful, please subscribe to the channel and turn on the bell icon, because every week we share important health topics specifically focused on older adults and their families. Now, let us begin with the most important question. What exactly is hantavirus? Think of your body like a protected city. Your immune system acts like security guards constantly watching for threats. Most germs that enter the body are stopped quickly, but hantavirus works differently. It slips into the body quietly and begins attacking one of the most sensitive systems you have, the blood vessels inside your lungs. The virus is carried mainly by rodents, especially deer mice in North America. The frightening part is that the rodents themselves often look perfectly healthy. They continue living normally while spreading the virus in their saliva, urine, and droppings. That means a room can look clean, a garage can look harmless, an old cabin can seem completely safe, but tiny virus particles may already be there without you knowing it. And this is where things become dangerous. When rodent droppings or nesting materials are disturbed, tiny contaminated particles can enter the air. You do not see them, you do not smell them, but when you breathe them in, the infection can begin silently. This is why experts warn people never to sweep or vacuum rodent droppings dry, because the moment those particles become airborne, they can move directly into your lungs. Now I want to explain why this virus is especially dangerous after the age of 60. As we get older, several protective systems inside the body naturally weaken. The lungs lose reserve capacity. The immune system responds more slowly. Tiny hair-like structures inside the airways that normally help remove harmful particles become less effective. This means something a younger person may partially clear from the lungs, an older adult may not. The virus can reach deeper into the lungs more easily. And once it reaches the tiny air sacs where oxygen exchange happens, the real damage begins. Hantavirus attacks the cells lining blood vessels. Over time, those vessels begin leaking fluid into the lungs. Imagine trying to breathe through a sponge slowly filling with water. That is what severe hantavirus infection can feel like. People go from feeling a little sick to struggling for air frighteningly fast, sometimes within just 24 to 48 hours. And this is why recognizing the early warning signs matters so much. The first symptoms usually look harmless. That is part of what makes this virus so deceptive. At first, it may feel like the flu. Fever, fatigue, muscle aches, headache, chills, sometimes nausea. Most people would never think dangerous lung virus. They think cold, flu, COVID, or simple exhaustion. Meanwhile, inside the body, the virus is multiplying. This stage can last several days before breathing problems begin, and this is where older adults must be especially careful. If you recently cleaned a rodent-prone area and then develop flu-like symptoms, followed by worsening shortness of breath, that should never be ignored, especially after 60. Because once breathing becomes difficult, the disease can escalate extremely fast. When the severe phase begins, many patients describe it as terrifying. Breathing suddenly becomes hard. Walking across a room feels exhausting. The chest feels tight. Oxygen levels drop. Blood pressure may fall. And some patients need intensive care within a single day. There is currently no specific cure doctors can simply prescribe to stop hantavirus. Treatment is mostly supportive: oxygen, intensive monitoring, mechanical ventilation in severe cases. That is why prevention matters so much, and I need to say this clearly. This is not a virus where you want to wait and see. The earlier doctors suspect it, the better the chances of survival. Now let us talk about the mistake that puts many older adults at risk without them realizing it: dry sweeping. This is one of the most dangerous things you can do around rodent droppings. When people sweep or vacuum dry droppings, the virus particles become airborne. The cleaning process itself becomes the exposure. That is why health authorities recommend wet cleaning methods instead. The area should first be sprayed thoroughly with disinfectant or diluted bleach solution and allowed to soak before cleanup begins. Gloves should be worn. An N95 respirator should be worn, and the area should be ventilated before entering. I know some people hearing this may think it sounds excessive, but here is the reality. A mask costs a few dollars. An ICU stay can cost thousands. And some survivors never fully regain their previous lung function. Now here is something very important that many older adults never hear from anyone. The virus itself is not always what causes the greatest damage. Sometimes it is the delay in recognizing symptoms, the delay in seeking treatment, the delay in telling doctors about rodent exposure. Many people wait because they think they simply have the flu. They stay home, they rest, they drink fluids, and while they are doing that, the lungs are quietly filling with fluid. That is why timing matters so much with this illness. If you have cleaned a rodent-infested area in the past several weeks and then develop flu-like symptoms with breathing difficulty, tell the doctor immediately about the exposure. Do not assume they will automatically connect the dots. That information matters. It may completely change how quickly you are tested, monitored, and treated. And after 60, timing matters even more because the body has less reserve to absorb severe lung stress. Now let me give you the 5 most important things every older adult should do this week. First, inspect garages, sheds, attics, cabins, and storage areas carefully for signs of rodents. Second, never clean droppings without protection. Third, ventilate enclosed spaces before entering. Fourth, learn the warning symptoms and act quickly if breathing problems begin after possible exposure. And fifth, talk with your doctor if you spend time in rodent-prone environments regularly. Especially if you live in rural areas, use seasonal cabins, or clean enclosed structures often. These are not complicated steps, but they dramatically reduce risk. And here is what I want you to remember after everything we discussed today. You are not powerless. Most people who become seriously exposed never knew the risk in the first place. Now you do. And awareness changes behavior. You can use protection, you can clean safely, you can recognize symptoms earlier, you can avoid dangerous mistakes that many people make without realizing it. That is how health is protected after 60, not only through medicine, but through information, preparation, and smarter decisions. And one more thing before we finish. Please share this video with at least one person you care about. A spouse, a neighbor, a sibling, a friend who owns a cabin or storage shed, because many older adults are still cleaning dangerous spaces exactly the same way they did 20 or 30 years ago, without realizing the risks have changed as the body ages. Thank you so much for watching Senior Health with Dr. Sarah Mitchell. Please take care of yourself, stay informed, and stay safe. Disclaimer: this video is for educational purposes only and does not replace medical advice, diagnosis, or treatment. Please speak with a qualified healthcare professional if you have concerns about symptoms, exposure, or your personal health condition.